Can you ask me any questions? Don't worry if the tone was tough. That is Magoha, son of Magoha. Now ask me something. This is the first time you are seeing me, and if you don't ask me anything, it means you are not honest. Yeah, it is true. Yes, identify yourself and ask.
Thank you, sir. I'm Sikuku Stella from Kenya Teachers College, a public institution.
I didn't know there was a TTC there. Is it new?
Relatively new.
How many years?
5 years.
That's not new. Shoot.
In your statements, you talked about the testing of teachers. And what about the non-teaching staff and the students? That is one. I was thinking about the situation in our institutions where most teachers do not stay on the home. Is it risky that they may come into the school and then when they go back home, somebody has contracted the virus, even after being tested, within even immediately after testing?
We have, I didn't emphasize because Dr. Kipsam had alluded to it. The problem we have is not an educational problem. It is a medical problem. I am assuming that you, as a principal, you are aware. Somebody had said, your leader here, Mr. Baraza, had said, Ministry of Education protocol. Ministry of Education has no protocol. We adopt the protocol from the Ministry of Health. And they are very strict, extremely strict. So one would suggest that if you are boarding or if you have food handlers among your institutional staff, they should be tested.
The teachers' college.
Huh?
The teachers teaching in the teachers' college are around 3,600.
Okay, fine. Yeah, I'm being told that the teachers teaching in the teachers' college are 3,600. Now those ones can be tested, but I was just saying that food handlers, people who are cooking for the children, they must be tested every 14 days. Because they are the ones touching the food. Some of the food may be cold food. If it is hot food which has just been boiled and they don't touch, that's okay. But what about the cold food? The other staff should be tested along with the teaching staff. It makes sense. And the numbers are not abnormal. You syndicate with a hospital or an institution that is next to you, that belongs to the Kenya government. If we are going to move in the direction I'm talking about, your institution, that's why I was asking that guy, and you didn't get the message. I was asking my brother in the kofia and the cap, that if somebody had COVID, what happens? And the important thing is for each of you to be attached to a particular hospital. You get the point? The first point would be that you engage the MOH there to ensure that you are tested and the staff are tested. If you are unable to test, then we shall not be able to. We shall not be able to do what? That's it. It's as simple as that. What was the other one? The students, that's a policy issue. It's a policy issue because, you are, I don't know how many students we have, but we have about 13 million students in the primary, secondary, and pre-primary. How do you test them? Do you get the point? So we test the teachers. We are assuming the teachers are moving up and down, going around, going to the shop, coming back. You can't catch them when they are teaching. And that one teacher does not bring the disease to the others. For the children, I'm hoping that you are the ones who will tell the teachers to tell them what to do. Because when they are in school, they'll be wearing what? Now, when they are at home, the mask may become a property of the family. Is there anything you can do? Au Kamau, vaa hiyo mask ya Mwangi, end up kwa duka. There's nothing you can do. But you see, you are saying this is not what is to be done. So we give people things that they are able to do. Yes? Yes?
Thank you, sir. Also want to find out, I think I read somewhere you had promised you will give the students, the learners, masks. So
Let me clarify myself, my sister, very clearly in English. We are thinking about primary school and secondary school.
yeah, that's why I'm asking. I got about our students.
I have said we are thinking about primary school and secondary school. Am I speaking in Kiswahili? And my advice to you, the cost of a cloth mask from Rivertex is 35 shillings. So 2 masks will be 70 shillings. Are you a leader? Do you want to continue leading, or do you want me to come and lead for you? Kaa chini, iko swali lingine mzuri kushinda hiyo? Amina.
Thank you very much.
Oh, yeah.
This is Mary on bike from St. Nicholas,
St. Nicholas where?
Nairobi.
Uh-huh.
Now that we do not have financial help to the private schools, whether it's a branch or whichever form,
Would you want to be realistic? Sit down. Let us be realistic here. Do you get the point? Let us be realistic because, and let us be fair to the government of Uhuru Kenyatta, because first of all, where does the government get money from? From my tax and yours. Right now there are families who are blue collar like me and you. The wife was working in the tourism industry. The husband was working in the transport industry. And they were perhaps paying tax to the extent of, every month they were paying tax to the extent of about 100,000 shillings. They are jobless. That tax base has shrunk. So that's why I say, become a leader. You are not one right now. Because to be a leader, you give solutions. You have to find solutions for us, for yourself. This is not the time. Let me tell you what you didn't know. The government gives us money for infrastructure. You have seen our schools, how they look like, isn't it? When COVID came, the infrastructure money was taken back to COVID. Do you think I should waste my time thinking about what we are saying? It's not possible. This is not the time. Don't even think about it. That's why I tell you, for me, everything is either black or white. And I expect you to be reasonable. Yes, huyu mama huyu amevaa mzuri huyu.
Thank you, sir. I'm Catherine Mapupu, Principal Igoji Teachers College. I wish to comment on 2 issues. You mentioned something to do with teaching practice, and you asked us the recommendations we could make so that we have the students finishing. I believe these principles will bear witness that the students that are being presented for exam, that was so good for us, but we still have a very big challenge. There is a performance contract that we have to handle, and it requires funding. The funding we get are grants for non-teaching staff salaries and other recurrent...
In the performance contracting, you will find that if there are external issues that has made you not to conform, you are not penalized.
Finally...
If it's not about funding. Because you see, I didn't come here to get a shopping list. I want you people to help us. No, and I'm talking from the bottom of my heart and from the standpoint of government. It is now time for us to get more with little. The little that you have, how can you conserve it so that you get where you are going? That is what is on the ground here. If you have not seen that, then perhaps you are not the right leader that we need at this time. Are we together, ladies and gentlemen? Because it's like the government has a sack of money somewhere that you want to get. Feel the pinch and let us move together. By the way, you can always do more with less. Look at this table. Do we need all these bottles of water here? Tell me. One bottle was enough.
Thank you. The final one is...
No. You must finish.
Yes, the final one is concerning the hybrid training. That would indicate that the current students would require to be exposed to CPC. Is it possible that they be given an extra term?
It is not possible because the times are not... No, it is not possible.
Yeah.
Dr. Belio Kipsang put it on the side. We need to train the trainers. If we give them an extra term, what time do you have for us to train the trainers? Do you get the point? So you experts have to sit down, because we really must train the trainers so that we start training teachers who are CBC oriented. I'm not shutting you down. It's just that when things are abnormal, then you adjust to them. There was a hand somewhere, the final one. Ah, my beautiful friend there. Sema.
Yes, it seems to have been covered by other questions, sir.
Oh.
I wanted to comment about the issue of cooks and the 14 days. I'm trying to imagine that today a cook is tested, is negative. 3 days later, he becomes positive.
He will be caught within the 14 days.
And then would he have made something negative on the part of the student?
Let me give you the best example.
Because we are doctors.
Let me give you the best example. We used Kabarak, like now we are using here, with the permission of Kagwe. Although here I can say I didn't come because wow, the work has been a bit too much. Yeah? And we ensured with the Belio that social distancing was better than this one, that everything was put in place before we went there. There were the sanitizers with automatic machines were everywhere. We went to the bedrooms and decided this one get out, this one remains. We went to the rooms and decided, okay, for this room only 5 people will meet here. So we created everything. And we finished. We had about 300, eh? Yeah. And they were there for 3 weeks. We completed. Then after a while, another lot was now planning to come. Where do you think the problem came from? Where? If that testing of 14 days was not done, those 2 people in the service department of the hostel would have interacted with this large group of 295. So you must test. If you don't want to test, don't open. Or if you don't want to test, we shall not open you. It is as simple as that. It is not a laughing matter. It's very serious. So now, when we found out, we were able to save the people. They went to self-quarantine at home because they had not met. And we said we shall plan for another day. If there's another very different question, one last question. Different. I like the ladies here. They are very versatile. Let me hear from you.
Thank you, sir. I'm Achumbo from Kericho TTC.
Yes.
Mine is just that when we open, we seem to be concentrating more on the key.
Are they resident?
I want to be assured that this will not interfere with training the trainers. Yes. Because we really must open, we must take students latest by May, if possible earlier.
The ECD ones, are they residents or they are part-time? They are school-based.
We have colleges and also have, school colleges have regular.
Anyway, I think Barasa, let's engage and then see how we deal with that.
No, but we agree here together as a team that in order for the CBC program not to be interfered with, we must train the trainers before...
Everything should be over by November.
We must train the trainers before May. We must train the trainers. That, I think, is the goal that you people... Do you agree or you don't agree?
We agree, sir.
Because me, I'm a Juakali teacher. You are the right teachers. So that's a problem we discuss on the side. And if it can be done...
By November, everything we want.
Why can you not do them at the same time?
Yeah, that's why we want to know that cohort, how it is.
It is possible because the ECD is only the exams.
It's only the exam.
It's only the exams they were supposed to come and do. Those ones had completed their course.
Okay.
Yes, and we
Then-
don't have first years.
then
So
sit on your-
only the last class. But
Sit-
only supposed to do exams.
And the numbers, how are the numbers looking like?
The numbers are small.
Small meaning what?
Some colleges have big numbers.
Like,
Mine I have regular and in-service.
how many? What is the number?
300 and sometimes 300.
That's not a small number. Well, you know, now your brains are working, and I'm very happy that we are almost ending in this. I will allow this gentleman to ask his last question, but it's good that your brains are working. You must find a solution on your own that does not interfere with the principal goal.
So I want to say that the ECD exams were captured. I'm sure that were in other forums elsewhere. It was captured. It's only that I can't say it because it must
So it is not a problem.
no. Even the numbers of the candidates.
Now, please allow this man only to ask the last question, because I also want to protect the Jogos gender.
Thank you very much. Mine is Mr. Samuel.
Hey, nikipata mmepanga namna, because when I come, I will want to look at on the floor how you have marked. Yeah.
Okay, my question is in ECD, and it's a plea to all the ECD sector that we need at least when you are deciding about the issue of the certificate level. We understand that we are raising the level of education.
Go to the point. Go to the point.
So kindly, we are considering one allow us to have the certificate for the ECD sector so that we can have the enrollment.
Dr. Kipsang, are you listening to what he's saying?
Yeah, I was consulting because he's the expert. We shall not have a certificate.
There is no certificate. Wewe unatoka wapi?
Yeah, I understand.
The policy, let me tell you, Kachin. This is the way the government works, huh? We are at the policy making level. The policy is made and switched. We bring it to you as tacticians. You are at the tactical level. You don't question about the policy because your opinions were taken earlier. As tacticians, now you plan and give to the operational level, which are the people who are going to teach. So you are taking us backwards. I want to thank you very much. I think I've enjoyed your discuss. You are very excellent brains, and I think we can exchange further. Please go and the ladies who have decided to put masks as a fashion statement, just ensure that they are measured properly so that when you put, it covers your nose. Unasikia? Hii kufanya kitu inaruka hapa juu lakini inawacha pua inatoka will be a problem. But you are very beautiful even in the normal masks. Thank you very much.